The nurse is caring for a child admitted with acute laryngotracheobronchitis. Because of the possibility of complete obstruction of the airway, which of the following should the nurse have available? The options are A. Intravenous access supplies, B. Emergency intubation equipment, C. Intravenous fluid administration pump, D. Supplemental oxygen. The correct answer is option B. Emergency intubation equipment. For a child with laryngeal tracheobronchitis and the possibility of complete obstruction of the airway, emergency intubation equipment should always be kept at the bedside. Intravenous supplies and fluid will not treat an obstruction. Question number 2. The nurse is ready to begin an exam on a 9-month-old infant. The child is sitting in his mother's lap. Which should the nurse do first? The options are A. Check the Babinski reflex, B. Listen to the heart and lung sounds, C. Palpate the abdomen, D. Check tympanic membranes. The answer is option B. Listen the heart and lung sounds. The first action that the nurse should take when beginning to examine the infant is to listen to the heart and lungs. If the nurse elicits the Babinski reflex, palpates the abdomen, or looks in the child's ear first, the child will begin to cry and it will be difficult to obtain an objective finding while listening to the heart and lungs. Question number 3. The home health nurse is planning for the day's visits. Which client should be seen first? The options are A. The client with renal insufficiency, B. The client with Alzheimer's, C. The client with diabetes who has a decubitus ulcer, D. The client with multiple sclerosis who is being treated with IV cortisone. The correct answer is option D. The client with multiple sclerosis who is being treated with IV cortisone. The client who should receive priority is the client with multiple sclerosis, and who is being treated with IV cortisone. This client is at highest risk for complications. Question number 4. The nurse on oncology is caring for a client with a white blood count of 600. During evening visitation, a visitor brings a potted plant. What action should the nurse take? The options are A. Allow the client to keep the plant, B. Place the plant by the window, C. Water the plant for the client, D. Tell the family members to take the plant home. The correct answer is option D. Tell the family members to take the plant home. The client with neutropenia should not have potted or cut flowers in the room. Cancer patients are extremely susceptible to bacterial infections. Question number 5. The nurse is caring for the client following a thyroidectomy, when suddenly the client becomes non-responsive and pale, with a systolic BP 60 mm of Hg. The nurse's initial action should be to. The options are A. Lower the head of the bed, B. Increase the infusion of normal saline, C. Administer atropine IV, D. Obtain a crash cart. The correct answer is options B. Increase the infusion of normal saline. From the options, the priority actions is increase the infusion of normal saline, then lower the head of the bed, and obtain crash cart. Administer atropine as the treatment of bradycardia, not for hypotension. Question number 6. The nurse is caring for a client with systemic lupus erythematosus. The major complication associated with systemic lupus erythematosus is The options are A. Nephritis, B. Cardiomegaly, C. Desquamation, D. Meningitis. The correct answer is option A. Nephritis. The major complication of SLE is nephritis, which results in end-stage renal disease. SLE affects the musculoskeletal, integumentary, renal, nervous, and cardiovascular systems, but the major complication is renal involvement. A client with psychotic depression is receiving haloperidol. Which of the following adverse effects is associated with haloperidol? The options are A. Akathisia, B. Cataracts, C. Diaphoresis, D. Polyuria. The correct answer is option A. Akathisia. Akathisia is an adverse extrapyramidal side effect of haloperidol. A 4-year-old is scheduled for a routine tonsillectomy. Which of the following lab findings should be reported to the doctor? The options are A. Hemoglobin of 12 gram per deciliter, B. A platelet count of 200,000, C. A white blood cell count of 16,000, D. A urine-specific gravity of 1.010. The correct answer is option C. White blood cell count of 16,000. Elevations in white cell count indicate the presence of infection, which requires treatment before surgery. Question number 9. An elderly client with glaucoma is scheduled for a cholecystectomy. Which medication order should the nurse question? The options are A. Meperidine, B. Cimetidine, C. Atropine, D. Promethazine. The correct answer is option C. Atropine. Atropine is contraindicated in the client with glaucoma because the medication increases intraocular pressure,